University of Colorado, Denver College of Liberal Arts and Sciences series, Conversations about COVID. My name is Marjorie Levine Clark. I'm a professor of history and the Associate Dean for Diversity, Outreach, and Initiatives in the college, and I will be your moderator today. I've been amazed at how much has changed regarding the status of the pandemic and the vaccination and masking conversations just over the month this series has run. We're at a really different place right now than we were on July 7th when we started the series. And I think with the new CDC advice on masking and the heightened discussions about vaccinations, there are certainly new challenges to mental health, and I'm sure we will have a chance to address some of these issues today. All the lectures in this series are recorded, and you can find them on the CLAS YouTube channel, usually on Friday, and Tracy will put the link in our chat. For Zoom etiquette, please keep yourself on mute for the duration of the program. Please use the chat feature to ask questions, although we're a small enough group that we can probably do raise hands if you're comfortable with that, or you can put your questions in the chat. And I hope we have a really engaging question and answer period after the lecture. I want to thank our outstanding faculty who volunteered their time for this series. And I also want to thank Tracy Combe, the CLAS Marketing and Communications Director, Tim Stalker, the CLAS Webmaster, and Kristin Salisbury, the Program Manager for CLAS Continuing and Professional Education, for their help on the technical side of putting this series together. Today's speaker is Associate Professor Kristin Kilbourn. Dr. Kilbourn serves as a core faculty member in the Clinical Health Psychology doctoral program within the Department of Psychology. She teaches a variety of undergraduate and graduate classes that include health psychology, clinical behavioral medicine, and group interventions. She also serves as a clinical supervisor for doctoral students who are seeing clients at the psychology clinic. She has an active research lab and mentors both undergraduate and graduate students in the area of psychosocial oncology, cancer survivorship, and palliative care. Additionally, Dr. Kilbourn has an active clinical practice. Her lecture is titled, Transitioning Out of COVID, What Do We Know About the State of Our Mental Health? Welcome, Dr. Kilbourn.
Great, thank you for the very nice introduction. I'm really happy to be here today. Nice to see some familiar faces and names in the audience, and thank you all for zooming in today. I know this is always a hard time halfway through the week at 4 o'clock, so I really appreciate it. Just to start off, my little disclaimer is that a lot of the things that I'm going to talk about and touch on today are based on not a lot of research, because we still don't know a lot. If any of you who do research know sort of the slow progression of, doing the research and then doing the analysis, getting it published. So there's not a lot of research yet, but some of it I'm going to be talking about with some of the work I've been doing with healthcare providers and the clients that I work with or my students work with and I supervise. So just to give you a little bit of background on that, with the hope that over time we're starting to see more research that's being done in this area. It's just too early to know a lot of that. But certainly I would agree that there have been a lot of changes even in the time that I've been working on this presentation, and I hope that we'll have time to have maybe some discussions or some good questions or discussions at the end. So just to kind of give an overview today, what I'm going to touch on. So I want to talk about the long-term psychological impact of the pandemic and what we know. I want to talk and touch on what are the groups that have the highest need right now. Also talk a little bit about what we might expect in the coming months, knowing that there's still a lot of uncertainty around that. We can't even predict the next day or two. And then I want to end talking a little bit about some of the potential positive benefits that we've gained. What are some of the things we have gained from this experience? So first, let's just talk a little bit, or I want to speak about why does it still feel so stressful? And I think first it's important to acknowledge that there's a continuum of where people are in terms of stress. So we have some people who are experiencing a huge reduction in stress now that they're able to socialize more, get back to sort of the routine and things that they were doing, thinking about kids going back to school and things like that. So there's certainly a continuum. But we know a lot of people are still feeling high levels of stress and distress. And we know some of that is just the cumulative factors, right? We've been worried about and stressed about fears about our health. Financial insecurity has been something a lot of people have worried about. The childcare stress, school, what's going to be happening in the fall when we start back up. Work-related stressors. There's a lot of differences amongst, the rules and regulations for different work sites and people going back, and certainly a lot of the social isolation that people have experienced over the last 16 plus months. Another reason that many of us are still feeling heightened stress is related to the continued high levels of uncertainty. So I don't know if any of you participated in the series last summer, and when I spoke a lot about this, of the stress of dealing with uncertainty and uncontrollable types of not only events, but different kinds of news and just not knowing, not having that predictability that makes us feel more comfortable. So for example, not only had we never experienced a pandemic like this in our lifetime, we've never experienced what it's like to be coming out of a pandemic. So we don't have a template or sort of expectations on what this might look like, what it might feel like. So there's a lot of uncertainty there. There's a lot of uncertainty around, are we really out? Have we reached that point? And when will we reach that point where we can say, this is like now past? So that's a continued unknown with these new surge of cases that we're seeing and some of the new recommendations and mandates that are coming down. And then there's a lot of inconsistency around the different kinds of rules, right? So it can be from state to state, from city to city, community to community, business to business. So I think we've probably all experienced where some places, when I go back to see my medical provider, or different types of areas, my acupuncturist, they're still recommending or have gone back to wearing masks. Other places where I go, they don't have a mask mandate, right? But you see a mix of people, some wearing masks and some not. So that causes a lot of stress, just that unknown and uncertainty and not knowing what to expect. And then of course, there's the conflicting messages that we're often getting. And again, recognizing that even these authority sort of figures or foundations or centers that we rely on are also in a place of oftentimes unknown or changing information, changing data, things coming in. So for example, the booster, right? A few weeks ago, there was a big thing that came out where Pfizer was saying, we're thinking the booster is going to be sooner rather than later. And then the CDC came out and said, no, that's not true. People don't need to be worrying about boosters right now. So think about that, just that, very stressful, thinking about that conflict of, well, what's right? They're conflicting with each other. We had this same thing up until yesterday, I believe, where there was this, the message was that children who were vaccinated could go back to school without masks. And now, but that conflicted, and so that CDC was supporting that, but the big pediatric group was saying, no, we're recommending that all children, despite vaccination status, should be wearing masks when they go back to school in the fall. And it was yesterday, I believe, that the CDC then flipped and changed their stance. So again, this is very stressful and confusing to people. And so it's this confusion of this different information we're getting, and then the stress of feeling like, how do I stay up on it all? How do I make sure I know what is the latest information and which one is what's right? So it's these constant changes and often unpredictable changes that cause us to still feel high levels of stress, or many people to feel that. So let me talk a little bit about what we know about the psychological impact of the pandemic. So as you might expect, there's not a lot of research in this area, certainly not regarding, global pandemics, but we do know a little bit from some past epidemics, for example, the SARS epidemic. So what they saw following that were persistent elevations in distress, depression, anxiety, panic attacks that lasted up to 3 years. And not surprisingly, a high level of post-traumatic stress symptoms in healthcare workers, which continued to persist again 1 to 3 years. What we know now in terms of how the pandemic has impacted us, and this is within the US, but pretty consistent. There's some factors that can add to distress, but pretty consistent across what we know globally. We saw elevations in anxiety, depression, certainly trauma-related types of disorders like PTSD. Sleep problems, I think, have been very well documented and talked about. Even, COVID sort of type dreams. We've seen an uptick in calls to crisis lines. So in Colorado alone, we saw up to 30% increase in calls to the crisis line. And we know that there have been, especially in specific groups, increase in people considering suicide. And I say this with the caveat of actually, in general, there's been a decrease in suicides, but within specific groups, we've seen an increase. And I'll talk a little bit more about that later. But specifically in groups like caregivers, younger people, people with sort of lower education, from specific demographic groups, ethnic groups, etc. We've also seen an increase in what we might call some unhealthy coping strategies. So alcohol use, marijuana, opioids, tobacco. So just one example of this, kind of the outcome of some of these things. For example, alcohol consumption has increased, and there's been almost an epidemic, they're calling it, in seeing young women with cirrhosis of the liver. So, hepatologists and doctors that work with people with liver disease have been talking about how this is not something that they've never seen their whole career, young, healthy women coming in with liver disease related to alcohol use. So I think we're going to start seeing more of those types of things as there's more time for some of the health effects to play out. In terms of the long-term psychological impact, I think it's important, again, thinking about that continuum where there are some people who are actually feeling like they're coming out of that sort of depression or place where they've been sort of stuck. As they're getting maybe back to work, they're reconnecting with friends and family, but also recognizing that there are other people who are continuing to experience distress or may even be experiencing a worsening of some of their mental health issues. And so I like to think about it, as you may have heard, I do a lot of work with people who are very ill, especially within oncology. And so when people are going through a crisis, and I see this all the time with the people that I work with, like going through cancer treatment, oftentimes they're just focusing on getting through it, right? And that was sort of the mentality I think many of us had as we were going through the pandemic. I just need to get through it, right? Do whatever I need, hunker down, do the things I need to do to stay safe. And then when it's over, I'll be able to maybe process some of what happened. And so that's a good, from a standpoint of mental health, that probably is very protective for us. But what happens is that it does catch up with us, right? So when I work with people who are going through cancer, we talk about when you get to the end of the treatment, you may be surprised thinking that it's going to feel great, but you actually have an increase in distress because suddenly you're having to process a lot of emotions. And so I think we're seeing this in a lot of folks right now where suddenly they're recognizing, losses that they may have experienced during the pandemic that they hadn't really acknowledged. I can give you an example of someone that I work with who, during the course of the pandemic, she lost her father and she also suffered a miscarriage. And those were things that she just sort of had to put on the shelf for a while because she was just trying to get through the day to day of the pandemic and work related stressors and things like that with her partner. And so now she's experiencing this high level of distress because now she's recognizing that she needs to process some of this. There's also just the grief of recognizing like the impact it's had on our community. That favorite restaurant that maybe you used to love to go to that's not there anymore. Or maybe neighbors that you're now finding out that have experienced some sort of losses. So again, it's this kind of processing that we're now just starting to do. We certainly know that there are a lot of demographic factors that come into play when thinking about who seems to be hit the hardest in terms of long-term psychological problems. And it's not a surprise. It's people that don't have a lot of social support, maybe experience financial difficulties, housing, food instability, and certainly people that already have a history of mental health issues we're seeing are having a harder time. We also know that the ebb and flow nature of a lot of whether it's COVID rates, whether it's where we, can we get a vaccine? You think of where we are now in July, and you think of where we were just 4 months ago, right? Where it was almost impossible to even figure out where to go to get a vaccine and where they were available. And I don't know if any of you, had as much trouble as many people I know with the website and figuring that out. And now we have more vaccines available than we have people who are interested in them. So this constant like ebb and flow. Something's really hard. You can't get toilet paper anywhere. And then a few months later, it's not an issue. So this is very stressful, kind of that long-term sort of surfing through all that. And then also just recognizing that the impact of the pandemic has been felt differently depending on the different groups. And I'm going to talk more about that now, just to recognize that. So let's talk a little bit about the groups with the highest need right now. So certainly communities of color, and I think that's been pretty well documented. For one thing, sort of separate from the pandemic, or maybe the pandemic had something to do with it, but certainly there's been a bright light that's been shined more on racism and discrimination. And we've seen this in racist attacks on certain groups, Asian Americans being one of those groups that have increased. This was certainly associated with the pandemic and this idea of the Chinese flu and things like that. There's a lot of stigma within communities of color also when it comes to mental health and being able to reach out for help and receive help. Lack of awareness about mental health care as well as poor access. That's had an impact why this group has suffered more in terms of the mental health effects. We know that in terms of COVID rates, there were a lot of disparities where groups like Blacks and Native Americans and Latinx had much higher rates of COVID. And also we saw increase in terms of hospitalizations and death rates within many of these groups. This is also a group that we know, this is the group where we saw an increase in suicide. So prior to COVID, sort of our standard idea of the typical person who was at high risk for suicide was, older, white, male, usually with maybe a substance abuse issue, alcohol in particular. That changed. So that group, actually suicide rates went down during the pandemic, but what we saw is an increase in suicide in these groups, communities of color. So that's very alarming, so interesting. We're also seeing these disparities in vaccination rates. So just recently I was reading some things about, there's this, I think, idea that a lot of people have about who are these people that are not vaccinated, who don't want to get vaccinated. And it's easy to sort of lump them into some like political ideology or something like that, but actually recognizing that it's much more complicated, that there are groups in, again, communities of color where the disparity in vaccination rates are related to just simple things like poor access to be able, not being able to get to a place where they can get vaccinated, not being able to find childcare so they can go and get vaccinated, transportation issues, a lot of the same barriers that we see in people being able to receive, sort of standard medical care. So I think it's important to be aware of that. Another group that is of particular interest and concern to me is the frontline healthcare workers. And I've been involved since very early on in the pandemic at Anschutz Medical Campus in particular in helping to run and lead groups for different groups of frontline healthcare workers, and have really been able to see and feel the level of stress that they've been working under. We certainly know that this group, and we know this even from the past epidemics, that this is a group that is very vulnerable to high levels of distress. And I think that the big concern now is that they've been working in the crisis mode for months and months and months, again with this idea like at some point they're going to get a break, and they never really got that break. So they were already feeling burned out and depleted, and now are facing this new surge, which was potentially preventable. And so you can imagine from the standpoint of mental health, how difficult and challenging that might be. I think the other thing is that there's been a high level of burnout in this group, such that a lot of people have just left the profession. And so a lot of what I'm hearing, a group that I led just last Friday, talking about, that they don't have enough people. People have left, they're having a hard time hiring new people. And so they're working even harder because they don't have enough staff right now. There's a lot of moral injury also that this group is dealing with. So we talked about just having to deal with treating people now who are unvaccinated and feeling like they could have prevented this. Just some issues around dealing with ethical kinds of things that are coming up. Again, that's very depleting in terms of our emotional health. And when they're dealing with this crisis of caring for people, they don't really have the time to be able to process and work through some of that. So I'm anticipating that probably we're going to see, what in psychology we would call sort of this complicated trauma and grief reaction in this group. And, I was thinking about it today, and it's almost like if you think of the military, when people are deployed, it's time limited, right? Because we know that it's just very difficult for anyone to be deployed and at that level of stress for a certain amount of time without some sort of break. And so it's almost as if frontline workers have been on this continual deployment without that chance for some rest. Another group that has been discussed a lot are children and young adults. So, especially if we think from a developmental standpoint, children, but especially thinking about teens and young adults, that connection with peers is so important and so important in that developmental process. And so this was just taken away from kids, for being pulled out of school, not being able to socialize with their friends and things like that, being socially isolated. Also, for a lot of kids who may have had an unstable home life, school was their stability and the predictability in their life. And we know there's been an increase in violence and abuse and things like that because of children and people being in the home where it may not be safe. We know that this is now played out in terms of children and teens, where they're seeing an increase in hospitalizations for suicides or suicide attempts. Alcohol and substance abuse issues and eating disorders have all increased to the point where even Children's Hospital has been talking about this pediatric mental health crisis that they're experiencing right now, and just not having the resources available to serve all of these children in need. I also want to call attention to a group that many of us are very familiar with, which are the young adults. And that this is another group that's really suffered quite a bit. We know has experienced high levels of distress because, again, this is a time, usually a developmental period that's already somewhat challenging. It's that time when you're trying to sort of figure out who you are, what you want to do in life, and your different roles and things, and how you connect with others, and you're trying to gain more independence. And so having this time where suddenly, you know, college kids ended up going back home and living with their parents again, were cut off from a lot of their friends and their peers, was very challenging. So this is another group that we're watching to see, you know, what we can do for them and how they're adjusting. And then I think, you know, the last group is just recognizing, and as a health psychologist, I think a lot about these folks too, that have had COVID and survived. So we already knew even before COVID, this what we call sort of ICU related trauma, or post-traumatic stress disorder, or symptoms that are very common in people who've been in the ICU for a long period of time. And so we're seeing that playing out now in those folks who unfortunately were hospitalized and put on ventilators and things like that for COVID, high rates of PTS type symptoms. We know that a lot of these folks, because of the potential neuroinflammatory impact of the illness, many of these people are now suffering with cognitive problems and issues, as well as psychiatric. Some of these people are ending up, because of organ damage and other kinds of issues related to the COVID virus, now have new long-term health issues that they're going to have to deal with. And most likely, a lot of these folks are experiencing, you know, a permanent decrease in their quality of life, and perhaps decreased life expectancy as a result of having gone through and survived COVID. So I think this is something that we're going to be seeing more and hearing more about this group. Interestingly, and I didn't know this till I was doing some research for this talk, they're saying that the younger people who are younger than 50 who had pretty severe COVID are actually experiencing more executive dysfunction issues and problems, cognitive problems. And the thought is that a lot of these folks, rather than being hospitalized, were cared for at home, and perhaps, you know, either the inflammatory effects of the disease weren't controlled as well, and or, you know, depleted oxygen level. But it's interesting to think that there's going to be a group of younger people, COVID survivors, that may have some lengthy or long-term cognitive issues as a result. And then, of course, there's the sort of long haulers COVID group that I think they've been watching. We're trying to understand more of what this group, how this is going to play out in the long term. So it's not that I can predict, but just some things to be thinking about what we might expect in the coming months. You know, as I think we're all experiencing, and even if we looked at the last 3 days, we'll have some great examples of that. There's going to be a lot of continued uncertainty and confusion related to public health messaging, what we're hearing and seeing in the media. And I think, you know, it's being able to sort of come to some level of acceptance of that this is all constantly changing and new for everyone. And so just being able to accept that, yes, there's going to be uncertainty. You know, today we have rules around masking, and it's okay if you're vaccinated to go certain places unmasked, but you know what? It could change tomorrow. And just being able to be able to accept that, rather than taking that with frustration or anger or different sort of negative emotions that we know aren't necessarily good for us. Certainly, we're going to see more burnout and exhaustion in healthcare workers. And I worry about this a lot, you know, as a health psychologist who works with a lot of people that are in the medical system, not only for those who are working in the front lines, but also for the patients that are being treated by them, because I worry about that high level of burnout. They don't have enough staff now. The quality of care, of how that could be impacted. You know, I think we're going to see, you know, a lot of people leaving the field. And as I said, we're going to see high rates of PTSD and a lot of severe symptoms coming out of this. I think we're going to continue to be seeing and thinking about how are we going to treat all these folks who have had either a worsening or now a new onset of some sort of psychiatric disorder and or substance abuse disorders. Unfortunately, before pre-pandemic, we already had dwindling or not enough mental health resources available for the need that we had, and now this has just been amplified. And then I also think that we're going to continue to see the worsening in terms of health disparities, that they're continuing to play out at all levels. So as we've seen, they played out in terms of COVID cases, COVID deaths, COVID hospitalizations. We're seeing them play out in terms of vaccination rates and who's getting vaccinated. So I think this is going to be something that we're going to continue to be challenged by and trying to think about what we can do about this. Now, as I promised, I want to end with thinking about some of the positive benefits or positive aspects to all that we've been through over the past 16 plus months. So first I want to talk just about at the individual level. And some of this are even things that I've seen in the people that I work with clinically or that my students see that I supervise. So I think many people can recognize that having gone through the experience of having to be socially isolated at our homes, we've really been able to recognize and think about what's really important in life and maybe done some reprioritization. I think we're seeing a lot of this right now play out in people who are making the decisions either to not go back to work or not going back to the job that they had before, or making decisions that maybe they want to spend more time with family. Maybe they enjoy working from home. So we're seeing a lot of this reprioritizing what's really important. I think, oftentimes in the work that I do with folks, what usually comes out, you see this a lot in people that go through traumatic events like cancer treatment. They come out of it thinking, things that I thought were really important maybe aren't as important, but things like connection to the people I care about, my family, my friends, those are the kinds of things that I want to put up on the top of my list in terms of priorities. We have, although sometimes we don't recognize it, we have definitely become more tolerant of uncertainty. So I always tell last summer what I used to tell people, and I'll say it again now, if back in March of 2020, we were told that, hey, July 2021, you'll still be having to do a lot of these same behaviors and experiencing still a lot of unknowns in the future, we would have probably said, oh, there's no way that there's no way I can handle that or manage that, right? But here we are. And so we've definitely gotten better at managing uncertainty and recognizing that there are a lot of things that we can't control and being able to accept that, which isn't easy and is a very a great learning task. A lot of people have also been able to focus on living in the moment. So I think mindfulness, which has always been there, was a pretty big thing before the pandemic, has really come to be highlighted in this idea of like, we cannot control what's going to happen tomorrow. So how can we just be in the now and enjoy and appreciate the now? So whether that's, being out in nature or just being able to focus on where you are now without that anxiety of what's going to happen in the future, or that anxiety about what happened in the past. I think a lot of people have been able to experience that and put more focus on that. And then there's just been, a lot of positives in terms of people picking up new hobbies or going back to old hobbies. In my work that I do, a lot of people I work with, decided they were going to learn a new instrument or take up an instrument they hadn't done in 20 years, or take up, some kind of artistic thing or new hobby or interest. And so I think that's been a real positive benefit. And also a lot of that, and overlaps quite a bit with self-care activities, of being able to take that time to actually focus on themselves and think about, what do I need for my own self-care and how can I integrate that into my life? So I think those are a lot of nice things that have happened at an individual level. So the second bullet maybe is my hopefulness, but and this was a question that came up last summer, which I think is really interesting. And we had a little discussion about this, about the stigma. Is this pandemic going to have a positive impact, at least on decreasing the stigma around mental health? And I feel like it is happening. It's slow, right? And there's still different pockets and groups that still are holding on to that stigma. But I think in general, I think of even like Simone Biles, yesterday, I think it was, being able to talk really openly about her struggles with mental health. We had the the sprinter who unfortunately was disqualified because of marijuana use, but also was able to talk about, her grief around, I think it was the loss of her mother. There was a swimmer, I mean, of course it's Olympics because we're at that time, but there was a swimmer I heard interviewed this morning on my way in on NPR talking about the pressures of being an Olympic athlete and how that's impacted her mental health. So I do feel like we're talking about it more, and the fact that so many people have been able to recognize and talk about their own struggles has made it easier for others. I think the same for the stigma, talking about grief and loss. It's become a little bit easier, and hopefully that's something that I would like to see become a cultural shift. It's hard to know if that's going to stay that way, but at least I'm seeing some positive benefit there. We're also seeing people that are feeling more comfortable or able to reach out for help, as well as other people volunteering and then being able to serve them and provide that help, which is really nice. Certainly, we've had increased recognition of social and racial inequalities. Where this is going to go is hard to say, but I think that I'm very, very hopeful in some of the changes that we're starting to see. And that this, as I said earlier, there's really been a strong light that's being shined, and we're becoming more aware of these things. I would also like to say, telehealth, which within the realm that I work in clinical psychology, has always been this we don't really want to go there. It's certainly not the optimum form of treatment. Nothing's better than face-to-face therapy. And I think that because we had to make this pivot as a result of this pandemic very, very quickly, in the case of our clinic and our students, they had to make this it was basically 2 weeks. So, we left campus and then we had spring break, and over that spring break time, faculty had to sort of figure out what the heck are we going to do? And the students came back and we were like, we're not doing any more face-to-face. In fact, we have, just interesting little tidbit, we have one whole doctoral class who started doing their clinical work last fall who have never seen a patient face-to-face. All their work's been done through telehealth. So I think that there's been a lot of things that we've learned in this process. We had to just learn it as we were going along. But I think that it's been now well established, or we're establishing that it does have an important place in medicine, but certainly in mental health. And that, sort of questioning that for some people, telehealth may be an optimal way to provide services. Certainly for those who live in rural areas, maybe those who have a lot of other challenges and barriers to getting in to the clinic and doing face-to-face. So I think this is a definite benefit and something positive that we've learned from this experience. And then the last thing I want to point out, and this is another thing that's really, I've been really excited about. I've always been really interested in this idea of resilience from my work with people dealing with different kinds of severe medical illnesses, or the caregivers and family members that are taking care of them. But I'm seeing more of this, rather than just always focusing on sort of the negative, the sort of psychopathology and anxiety, depression, this sort of conversation about resilience. And it's at all different levels. It's not only like, how can we build resilience within individuals, but within families and within communities. And that's a really nice overlap, I think, with my, psychology and public health interest and background, is thinking about, like, at that larger level, like communities, how can we build resilience and help people recognize the resilience that they've probably gained from this experience of the pandemic, and to build on that. So I'm excited about that area. So in conclusion, just some things we touched on, or hopefully you feel like you know a little more about today after this talk. Certainly, I'm expecting that we're going to continue to see at least people who are at high levels of distress, and maybe even elevations in distress over the coming months and potentially years, given what we know from past epidemics. We're still not really, it's still unclear of what that long-term impact is going to look like, since there's so many factors at play here, right? There's health medical factors, there's economic factors, there's social factors, there's, a lot of different things here that we just don't know. So it's hard to predict. Just going to be a lot, we're going to have still a lot of uncertainty for, I think, a long period of time. I think that recognition, and I think there's been more talk about this recently, and I'm happy to see that, but really that recognition that there's been a very disproportionate level of suffering, and in different groups, especially, who have suffered more. And then I think recognizing that despite all of the trauma and challenges that we've all faced over the last 16 plus months, that there are some positive things that we've gained from this. And I think sometimes just to be able to recognize that, and think about even individually the sort of growth and maybe resilience that you've experienced personally, as well as maybe within your community, can be really helpful. So with that, I want to thank all of you who were here today, and I would love to take any questions or any thoughts that folks have.
Thank you so much. There's a lot to think about there. I would love to start us off with something that I thought was really interesting when you were talking about healthcare workers, that you mentioned this kind of feeling of betrayal with this kind of new surge, kind of thinking about the moment that we're in right now, because of its preventability with the vaccine, that they're under such stress already. And I wonder if there isn't a little bit of that in the community at large as well. That we're seeing this, this language of a pandemic of the unvaccinated, and this kind of, I'm just thinking of press representations of this anger at people who are unvaccinated for potentially needing to mask up again. And, this is this sense of betrayal and anger, and, what could the wider mental health aspect, kind of impacts of that be?
Yeah, I think that's a great thing to point out. And I think I just saw something today that came through on one of my news buzz about that sort of anger of this, potentially preventable surge that we're having now. And that, now people who felt like they did the right thing, went and got vaccinated, are potentially going to be pushed back into masking, social distancing, and who knows what may be the next level. So I think that's certainly going to add to the heightened distress that people are feeling. Um, I think, I was reading, I think it was in the Atlantic, there was a great article recently, though, that was helpful for me, of recognizing kind of what I was talking about, that it's easy to sort of point fingers at and say it's that group is very homogeneous, that group of unvaccinated people, but recognizing that it's very heterogeneous, and there are a lot of reasons why some people haven't been vaccinated, and just being able to recognize that sometimes it's just barriers to being able to get there, or barriers to information of understanding the reasons for why it's important and things like that, which can, I think, help sort of maybe mediate or moderate some of that anger and distress. But I agree that that is something that people are going to be having to deal with. And, kind of what we talked about when we were more in it, or a year ago, are the same sorts of things that I tell people are, limit your media consumption, focus on your self-care, focus on those things that are really important, and try not to put too much energy into, those sort of negative emotions, and just recognize that there are things that you can't control, and just being able to accept that. It's hard, but yeah, certainly that's going to be something that's going to be coming up, or is coming up.
Thank you. There are questions, comments?
Hey, Kristin.
Hey.
All right. Thank you for this talk. It was wonderful. So I think I might have a couple questions. One of them is just in terms of what you said, how do we balance putting some of those negative thoughts out of your head and focusing on yourself and all that with acknowledging the losses that we've had?
Mm-hmm.
And I would imagine it's a matter of balance, right? Of not getting too far into denial or too far into ruminating about loss and grief.
Yeah, I mean, I think that we know when it comes to processing grief, I always use that wave analogy. It also helps that I grew up on the beach, but it's, comes in waves. And so recognizing that we are able to process grief while we're also continuing to work through other things, and knowing that denial and pushing it away is not helpful, but also recognizing that, as you were pointing out, Mitch, that rumination process is also not good. So finding that balance, for people that are going through the grief, it's, finding that time, grief is something that takes work and energy, and acknowledging that and taking that time that you may need, whether it's journaling or self-care work, or doing some of the things that we know are good for emotional processing, I think can be really helpful. But recognizing that there's also, you can put some containment on it too, so that it's not constantly there, and that you're able to do other things that you need to do in your life. So it's sort of that fine line of finding that right balance. But I do agree, Mitch, that a lot of people are in that space right now and feeling challenged by that.
Thank you.
Mitch, did you say you had a second question?
Yeah, let me just throw this out, because I don't want to start the therapy session just yet, but what I found was I found it relatively easy and affirming to do the pandemic at first. They told me to stay home. I knew how to do that. I stayed home. Everybody at the university was so nice. They taught me how to teach online for the first time. It was wonderful. But and because there was a finite number of choices that we had. Now I'm finding the stress way more now that things are loosening up than it was at the beginning. And it's, like I'm almost hoping that there'll be another shutdown, right? Just to give me a little bit more time to adjust. So I just want to hear some about that. And I know about, adapting to stress and long-term stresses get tougher so that when there's an additional one, things get even worse. So can you just speak to that for a
Yeah,
bit?
definitely. Yeah, I think a lot of people are feeling that sort of ambivalence, right, about going back to some of these old activities. Some of it is anxiety and fear around, for example, social interactions. You know, I can't tell you how many conversations I've had with people like, remember, social skills are skills. And when we haven't been practicing them for 16 plus months, we're going to feel pretty rusty when we come back. And you know, I say, you know, just even acknowledging that and recognizing that and not being critical of ourselves. And when we're saying, wondering, why am I feeling so, I'm excited to go back to campus, but I'm also feeling a little nervous and anxious. What is that about? And being able to recognize that. You know, I think there are people that are struggling with this, like, you know, as you're saying, Mitch, it was hard at first. The learning curve was really steep, but I figured it out. And now it's kind of nice to be able to, you know, be at home and go make my lunch or have my laundry going at the same time, or, you know, my pets are very happy. We're all worried about how our dogs are going to adjust when we go back to work, right? And so I think there's some people that have recognized, like, wow, I kind of like this. I'm not sure I'm ready to go back, or to go back with dealing with the traffic. I don't know if any of you experienced that. It feels like it's all back. You know, it's sort of like these daily life stressors and hassles that we haven't had to deal with are now suddenly all coming back at once. So I think recognizing that, I'm certainly feeling that, you know, the traffic, all this. Just today I was thinking about, wow, it was really nice a year ago when you weren't stuck in all this traffic all the time. You had to plan way ahead of things. You know, my own personal, you know, I've been back in the office doing clinical work for now about a month. And the first couple days were just so anxiety ridden because I had forgotten what it was like to plan. I forgot things I needed to take, files and paperwork. I forgot my computer one day. I mean, just I'm not used to that. I've had everything I needed at home, and I hadn't thought about going back to the office and what I needed to be taking and thinking ahead and how long is it going to take me to get ready and all that. So I think this is really real. And I do think that is why a lot of us are experiencing more stress and anticipation of some of these things that are going to be changing again.
I appreciate your answer in terms of the little things that kind of add up. It may not be a huge stressor that happens. It might just be one traffic jam or something like that. Mm-hmm. And for some of us, the social skills that we had were tenuous 15 months ago. So to have them atrophy even more is really tough.
So I want to acknowledge, I want to acknowledge Tara's comment in the chat that there will be a large amount of stress on people who will lose their jobs due to not being vaccinated.
Mm-hmm. Yeah, I think not being vaccinated, that there's going to be there already is, I think, although it's not necessarily recognizable in terms of who these people are right now, but a stigma to that. And then I think also the stress again on people who are making different choices of maybe they don't want to go back to that same job, or they want to cut back, and the pressures they may feel. So yeah, I think those are definitely important. Or, there's a whole group of people who can't be vaccinated for different reasons because of their health status or things like that are beyond their control. And I know that group also is feeling stigmatized because there's not a lot of understanding of why they're unable to be vaccinated. So yeah, we could do a whole talk just on that. It'd be really interesting.
Everyone's saying thank you. Is there one more question, perhaps?
Yeah, I'm going to put you on the spot for a second, if I could. One of your slides showed that 56% of the people 18 to 24 have suffered from anxiety or depression. If even, I don't know, a third of those students come back still suffering from those issues, are we capable as a campus of providing service to them? And if not, could you estimate like kind of the gap between where we would need to be in order to provide some sort of support for all of them?
Yeah, I don't know if I can do the second part. I can say that this is an issue that we were dealing with way before the pandemic, you know, and I think a lot of us that work with undergraduates have been aware of this. There are a lot of different hypotheses and theories about why, you know, it seems like whether we call it this generation or seems to have more distress than past generations. You know, people talk about social media and just different ways that they interact with their environment. I don't know what the answer is to that, but it's been something that we've been seeing for the past few years across the country on college campuses. So I guess my short answer is I know that this was something we were trying to tackle before the pandemic hit, of feeling like there are not enough resources. I know I can only speak a little bit for, well, I can speak a little bit for our clinic, but I know the college, I can say, has really been trying big efforts to try to not only recognize the need, but think about what are the different ways that we can, knowing that we can't probably at this point in time provide face-to-face services to all the people in need, but what other kinds of options are there, you know, group-based types of interventions, web-based, you know, how can we create a culture, hopefully, where there is less stigma about being able to talk about these challenges. So I certainly can't speak, I could say probably pretty confidently that no, we don't have the mental health resources available for everyone to receive the optimal care that I would, at least as a psychologist, say that they should get. But I think it's something that's, there's a work in progress. And I think there is awareness that this is a huge need for faculty and staff also. And I think I can't compare our college to others, but I feel like our college, CLAS, has been really on top of that and really aware of that and working with folks to figure out what we can do to alleviate some of this.
Thank you.
Thank you so much. I'm losing my voice, but this was a really great presentation and such important information for all of us. Again, the whole series is up on YouTube. Tracy posted the link. And thank you again for attending. Have a great rest of the summer. We start in about 3 weeks. So enjoy yourselves. Thanks again, Kristin.
Thank
Take
you.
care.
All
Thank
right.
you.